On this day, 60 years ago, President Lyndon Baines Johnson signed the law that created Medicare and Medicaid, protecting the health and well-being of hundreds of millions of American families. Those were our predecessors here on the floor of the United States Senate, and they passed that bill by the overwhelming vote, at least by today's standards, of 68 to 21, with support from senators of both parties. And they did that because they understood how vital access to affordable health care is for all Americans. It was 15 years ago that Democrats and President Obama built on that legacy with the Affordable Care Act, which expanded Medicaid and delivered affordable health care to 45 million more Americans. Taken together, Medicare, Medicaid, and the Affordable Care Act are three parts of one promise: a promise of health and a measure of economic security for seniors, for people with disabilities, for the most vulnerable Americans, and for Americans working hard paycheck to paycheck. 60 years ago, one senator explained that the promise of Medicare and Medicaid meant this, and I quote, "We do not intend to kick you out on the street. We are going to see you through. You are not going to become forgotten people." That's how one senator explained his vote to make sure we provided coverage under Medicare and Medicaid. Well, 3 weeks ago on the Senate floor, President Trump, with allies among the Republican senators, forgot about those people for whom that law was passed 60 years ago today, because 3 weeks ago, right here on the Senate floor, Republicans called what Donald Trump calls the big, beautiful bill. Certainly is beautiful if you're a billionaire or a very wealthy person. For everybody else, it is an ugly betrayal, because that bill passed about 3 weeks ago here on the Senate floor slashed Medicaid. It cut into the Affordable Care Act and combined cut over $1 trillion in health care to fund tax breaks for billionaires and very wealthy people, taking health care coverage away from 10 million people, even more if you count the failure to extend the tax credits from the Affordable Care Act, which will expire at the end of this year, but 10 million on the terms of that bill alone, including nearly 246,000 of my fellow Marylanders. And as others have said, this will increase the costs of health care for everybody else because it has a ripple effect throughout the insurance markets. When you start denying affordable health care to people on Medicaid, it puts upward pressure on premiums for everybody else as people go to get emergency care in hospitals and other places. Now, one of our Republican colleagues reportedly said to members of the Republican caucus, and I quote, "I know a lot of us are hearing from people back home about Medicaid, but they'll get over it." That was the quote from a Republican senator. Mr. President, I can tell you from talking to my constituents and hearing from my colleagues all over the country, the American people are not going to get over it. Because of this bill that was passed 3 weeks ago, millions of Americans are going to lose their coverage, not because they're ineligible, but because Republicans purposely put up all sorts of bureaucratic hurdles to assess accessing those health care needs. That is increasing the costs and making it harder for people to access health care. And because of the failure to extend the tax credits for the Affordable Care Act, a big part of those tax credits, which will expire at the end of this year, another 20 million Americans will see their premiums jump an average of $700 starting in January. And in my home state of Maryland, I mentioned that about 246,000 Marylanders are going to lose access to health care because of the bill passed 3 weeks ago. And if we don't fix the issue of the expiring ACI tax credits by the end of the year, 70,000 Marylanders could lose their health care coverage altogether, and they will see their premiums increase 68%. As others have discussed, rural hospitals were already in a very, very tough position across the country, and now hundreds could close. We're also seeing seniors put at greater risk in nursing homes because of cutbacks on the number of nursing staff that we normally require to make sure that people's elderly loved ones get the care they need and deserve. And these cuts will make families face impossible choices. And again, all of that, those cuts to Medicaid, the cuts to the Affordable Care Act, all for one purpose: to partially offset the cost of tax breaks for billionaires and wealthy people. And I say partially offset because even after cutting Medicaid, we're going to see an increase in the national debt of $3.5 trillion over the next 10 years, and that doesn't include additional interest on that debt. Now, by cutting Medicaid so deeply, President Trump and Republicans are hurting people at every stage of life. You know, doctors take an oath to make sure that they help people at every stage of life, from cradle to grave. What happened 3 weeks ago is going to hurt people from cradle to grave. For many, it will be an early death sentence by denying access to important care, including preventative care. Officially, death certificates may read, died from late-stage cancer, or because of an accident in a nursing home. But when you look behind that, you'll find that it's because that late-stage cancer wasn't detected earlier, or because the nurse who should have been there at the nursing home wasn't there. And that will be a result of the bill that passed 3 weeks ago. Now, Mr. President, we believe that Donald Trump and Republican senators know better. We certainly know that they heard from their constituents about what would happen if this bill passed. Like many, I received letters from hundreds of constituents saying, please don't pass this bill. And I'm just going to read 2 short excerpts from a few of my constituents. Mary from Carroll County said, and I quote, "My 52-year-old son is battling colon cancer and has to undergo chemotherapy every 2 weeks. He's been sick since 2019 and lost his business and cannot work. He lost everything and is living with me and on Medicaid. The chemo is enabling him to have 1 good week out of 2. If they take his Medicaid away, it will be a death sentence." That's what Mary from Carroll County said. Frank from Cecil County said, please, please, in all caps, do not pass that budget. I have an autistic son who can only work part-time at a grocery store. He's on Medicaid. If he loses his insurance, we will not be able to cover him. Please do not let this happen, please. Mr. President, I received these heart-wrenching letters from many constituents, and I know that all of us in this Senate did as well. Unfortunately, we saw over 50 senators look the other way in the face of all of those letters and instead vote for a bill that cut health care for millions of Americans in order to partially finance tax cuts for the very wealthy. We cannot allow this to continue. In fact, we need to reverse it. And that is why I am joining others on the Schumer-Wyden bill to repeal the health care cuts that were enacted in that betrayal of a bill 3 weeks ago, and to permanently extend the Affordable Care tax credits, which will otherwise expire at the end of this year. Again, 60 years ago, former senators passed the Medicare and Medicaid law. They enacted that, improving the lives of millions of Americans. 3 weeks ago, we saw the opposite happen, the great betrayal. We need to make sure that we reverse the damage that was done, and then we need to build a better healthcare system for every American. That's what we should be doing at this point in our history, and build on the legacy of the senators 60 years ago, and build on the legacy of the Affordable Care Act. Mr. President, I yield the floor.